Well, thank you for having us. As we mentioned, we are Helous. We strive to solve problems that create an unnecessary burden on healthcare workers while improving the health of every patient through nutrition. So to get into that and a little bit about our main focuses. So we're primarily focused on staff care and patient care. And these two buckets have really accelerated in a need over the last year and a half, as we've seen with the COVID-19 pandemic. Firstly, with staff care. There are nearly 3.9 million nurses in the United States. 1 in 3 of them left their jobs in 2020, primarily caused to burnout and overworking. On the patient care side of things, because of this staff shortage, we've seen patient care really start to fall and really be impacted by this overall pandemic. One of those key metrics that comes out of patient care is actually patient malnutrition. Nearly 30 or more than 30% of patients in United States hospitals are affected by malnutrition just over the last year. So this is the problem that we really seek to focus and solve. So as I said, patients are exposed to these unnecessary health risks, and there's a skyrocketing liability. Healthcare workers are overburdened and understaffed, and overall there's a poor experience for patients during their hospital stays. So this is where Helous comes in. So Helous is a digital solution designed to make ordering meals safer for patients and easier for patients. So we're really putting the control back in the patients, which is something they really lose when they enter a hospital. So as you can see here, this is a demonstration of our patient view. So a patient would log in with their medical information. It's EHR integrated, so it's all their medical information on there, and they can scroll through the menu and see what they're interested in. This menu is being updated by the food service staff on a daily basis, however often the hospital updates their patient or their food services. It's also worth noting that the patient is only seeing items that is included on their dietary restrictions. So if they're a diabetic, for instance, then certain items will be automatically removed from the system because they logged in with their medical records, and so that patient won't even have the option to see that information. Moving on to the staff side, so designed to make tracking nutrition ordering by patients easier for the staff. So we really want to make sure that we're moving work out of the staff's hands to streamline communication. This is really addressing that problem that we talked about earlier about overworking and overburden on healthcare staff and nurses. And so for a nurse to have to go into a patient's room and assist them with ordering a meal, with putting on PPE, every time they enter and exit that room, it takes time and effort and energy. Whereas if we're able to keep this in the patient's hands and have the staff still be able to see what's going on, be able to see, okay, did my patient get their meal ordered? Is it on time? Is it on its way? What did they order? What time did they order? So that they can time out medications or just be up to date with their patients. They're able to all see this on their view without ever having to enter the patient's room. We additionally think that this also offloads dietary mandate confrontation from the staff to the application. So no one likes to be told what they can and can't eat, as we all know. And so being able to take that confrontation off of the staff and have the focus be more on the app, I think is a big benefit to that side as well. Now a little bit about our value proposition overall to a hospital. So we're primarily targeting right now hospitals ranging from about 50 beds to 200 beds, so smaller to medium-sized hospitals. For an average 100-bed hospital, we have the potential to save that hospital up to almost $10 million in a year. So that comes from $9.1 million in potential savings from the prevention of malnutrition and nurse burnout per year. So that comes from nurse turnover rates, having to hire new nurses, losing nurses, that sort of thing. I believe there's additional nearly $700,000 to be expected in operational savings per year. And overall, we see about 435 working hours being saved per week just from the implementation of Helous. Now a little bit about our financial projections. So currently we're working on acquiring a partnership with a 100-bed hospital for a beta test. With that acquisition in the year of 2021, we hope to bring in a revenue of about $150,000. In the year 2022, we'll hope to retain that partnership with that initial institution, and then add on 5 subsequent hospitals similar in size to that hospital. And with those additional 5 hospitals, we look to bring in a revenue of about $850,000 in the year of 2022. I want to thank you for your time. We really appreciate being here. This is a great honor. and we open the floor up to questions.